Hey there, Miss Hall. My name's Ronnie. I'll be helping you out today, going over a few things about Ludo. I got informed that Dr. Diaz had made a diagnosis of a mammary tumor, and that we need to see about removing that. So I'm going to go over the steps involved with that, what everything means, where do we go from here, and make sure that you're comfortable with every bit of the information and all the steps we'll be taking. First and foremost, I get how anxiety inducing this must be and stressful, a little scary. We hear those words that we've got a mass and that we need to remove it. And obviously, everybody who's been around it before, their mind automatically defaults to the big nasty C word for cancer. Um, just here to let you know that we're going to be with you every step of the way. I want to make sure that you are as comfortable as you can be with this process, that you understand everything, and that's going to help with some of that anxiety, and also understanding that every one of us has been touched in some way, shape, or form by it before, and we greatly respect your feelings and your emotions during this process, and want to make this as seamless as possible, both for you and for Ludo. Um, a little bit of information about this is the most common thing that we see in female dogs as far as a mass or a neoplasia, meaning abnormal kind of cancerous growth. So where I'm going with that is you're far from alone. You're not alone. There's plenty of people that have gone through this and are going through this, and you're in good company. What they plan to do is a single mastectomy, so we're just going to remove one of those glands, not an entire chain of them down one side or the other. There's not definitive information whether removing a entire chain is more beneficial than just a single, so we're going to start with the least radical thing and see where we go from there. We'll do some diagnostics ahead of time. We'll do x-rays, radiographs, we'll do a battery of blood work, and we may even potentially do a abdominal ultrasound or other places on the body to rule out metastasis or the spread of that if it is indeed cancerous. We want to know ahead of time what we're dealing with and how bad it is. That's going to be very important for the staging process. And not only that, but pre-surgery as well. We'd like to know if anything is, so to speak, sleeping in the dark, waiting to rear its ugly head as soon as we go under anesthesia. We want to know ahead of time before anything like that, so that we can better prepare and or decide if we are the best surgery candidate. We don't want to go under just haphazardly. When we do that surgery and remove that mass, we'll send it out for what's called histopathology, where a pathologist at a reference lab will look at samples of that under the microscope and analyze it, make sure that we've gotten all of it, and what those are called margins, if we've gotten clear margins on that, or if some of that mass was maybe just a little bit of it was left over, and then we've got to go from there. Whether there is metastasis or not, whether we need to do additional or more aggressive treatments. Leads me to my next thing. What do we do? What kind of treatments are we looking at? Well, with cancer patients, we ask two main questions. What kind of tumor are you dealing with, and has this thing spread to anywhere else in the body? And how bad has it spread? How many places has it spread? So on and so forth. That's all involved with grading and staging. Anybody who's been around cancer, I'm sure you've probably heard those words before with, hearing about friends or relatives, or just in general reading about cancers. Um, we want to know if it's benign or malignant, meaning is it mostly harmless, or is this something big and scary, or does it fall somewhere in the middle? That's where the grading and staging comes in, and the classification of this. So this is the histopathology is going to be a big fact-finding mission, and will provide us with definitive information that will help fill in all those blanks. General rules with this. It's a rule of 50s in dogs with this type of tumor. That what I mean by that is 50% of them are malignant, 50% of them will metastasize, and 50% of them will be cured completely with surgery. So we just need to know where we're going to end up. Everything's not always doom and gloom with this. We're on your side, and we just want the best for you and for Ludo. Where we go if things are not quite as we planned, if things end up a little scary, if we don't get complete margins, or if it's a particularly aggressive tumor that we're diagnosed with, where do we do from there? Well, one thing we always emphasize is quality over quantity. Always quality over quantity. What I mean by that is we still want quantity too, meaning, of course, lifespan. We want quantity, but not at the expense of quality. Um, I think most would agree with me. What good is a prolonged life if it's a prolonged miserable life? But if we had half of that amount of time and it was just glorious quality of life, then I think most would agree, and myself included. I've been there before with my own cancer babies. That quality is much more important in the primary concern over quantity. We still definitely we want them to live forever. We all do. We want quantity, but definitely never at the expense of quality. Another thing we look at with that is is examining our treatments, curative versus palliative. And you may have heard of palliative. You may be wondering what palliative is. Curative is obviously something that cures the condition. Palliative means that if we're facing something scary and nasty and it's not able to be cured, palliative care means we are going to keep that quality of life as high as possible for as long as we can. That's keeping us comfortable, keeping us happy, and keeping the day-to-day life as close to normal as long as we can. Our chemotherapy is an option. Everybody who's heard chemo, I'm sure you probably had experiences with that. Probably the first things that come to mind are in experiences with people losing their hair, being sick, things like that. Chemos can be a little hard on them. In some cancers, the juice is worth the squeeze. You do what you have to do if it's a very aggressive cancer. In this particular form of cancer, we can do injectable and or oral forms of it. They're generally not very effective against this kind of cancer. So we're not going to focus on that unless we absolutely are pushed against a wall and have to do something like that. Things that we can do. Hormonal therapies, what I mean by that is even a spay procedure, an ovarian hysterectomy, taking care of reducing that hormone load within the female body. There are anti-inflammatories that can be given that have what we call anti-angiogenic or anti-tumor properties. Anti-angiogenic means that we cut off the ability for the blood vessels to grow inside the tumor, effectively cutting off water to the plant and slowing that down. And those are tablets that you can take at home. There's another therapy called Palladia that may be of some interest. There's not quite as much information as far as clinical trials and whatnot. There are some, but not nearly as much as with chemotherapies and with the anti-inflammatories. But you do have some options, is where I'm going with that. And we'll explore those with you based on prognosis. What decides a prognosis? The size of the tumor, whether we have lymph node involvement, many different things can go into affecting and making the prognosis more friendly, making it a little bit more a little bit more involved, things like that. If one thing is the tumor size, of course. In dogs, if it's less than 3 centimeters or stage 1, we generally have a much longer survival time. If it's over 5 centimeters, then we need to kind of go back to the drawing board. Things are getting a little bit more involved. But at the end of the day, just to revisit, we're going to hold your hand and we're going to make sure you're comfortable with this. And any comments or concerns or anything that's setting you at unease about the situation, I want to be able to help you with and walk you through to the best of my ability, okay? And we're going to get through this together, all right? No matter what.
All right, sounds good.
All right.